Welcome back to the most news in the morning. Democrats on the Hill are passing around new details on a revised plan for health care reform this morning. The president took the plan to an online town hall denouncing so-called scare tactics from his opponents. Those critics say it is the first step towards government-run health care. Jim Acosta sat down with one insider from the health insurance industry. Jim joins us now live from our Washington bureau with that side of the story. What did the industry insider have to say, Jim?
Well, John, he wants to get in on this battle over health care that is escalating in Washington. Groups on both sides are flooding the airwaves with ads on the issue. Now, a health insurance company insider has stepped forward to warn the public about the industry's practices and some of those ads shaping the debate. For 15 years, Wendell Potter worked for the health insurance giant CIGNA, most recently as the company's chief spokesman. These days, he's telling a different story about the industry.
I know from personal experience that members of Congress and the public have good reason to question the honesty and trustworthiness of insurance companies.
Potter told a Senate hearing on health care the industry is only out to please investors.
I was going to say that you're better than Russell Crowe on the insider.
He told CNN how his former company would drive small businesses with expensive claims to dump their CIGNA policies, a practice Potter says the industry calls purging.
When that business comes up for renewal, the underwriters will jack the rates up so much that the small businesses have no alternative but to drop insurance.
The employer walks away.
The employer walks away. In
an email to CNN, a CIGNA spokesman says, "We do not practice that. We will offer rates that are reflective of the competitive group health insurance market. We always encourage our clients to compare our proposed rates to those available from other carriers." Potter finally decided to leave CIGNA after visiting this medical charity event at a Virginia fairground.
It was almost like an electrical joke, almost like being hit by lightning. It really was.
Where he snapped these pictures of doctors offering free health care to the uninsured.
The volunteer doctors were seeing patients in barns and treating people in animal stalls.
And this changed it for you?
It changed it for me, just seeing that.
Now a supporter of health care reform, Potter is taking aim at those TV ads, warning of a government-run system.
Now, Washington wants to bring Canadian-style health care to the U.S.
Sometimes you'll see misleading information, sometimes outright lies, like that is.
Not so, says the conservative group running the spot.
We're not saying that there's a Canada, Health Care Act of 2009.
But that's what the ad implies. The ad implies Washington wants to bring Canadian-style health care to the U.S. That's what it says.
It is. It is that trend. It's trending in that direction.
There are a lot of critics of health care reform who say that we would be possibly rationing care if we reform health care. What you have now is rationing by corporate executives and who are beholden to Wall Street. It happens all the time.
The leading health care proposals in Congress would not set up Canadian-style health care in the U.S. They do offer Americans the options of joining a government-run plan. Critics say that would drive insurance companies out of business. Wendell Potter says the option would keep the industry honest. John.
Going to be a lot more discussion about this in the days and weeks ahead. Jim Acosta for us in Washington. Jim, thanks so much.